What else is coming up?
So Ray, we're talking about cracking the code to addiction. I know it sounds too good to be true, but in today's interview, Dr. Charles Canfield's joining me and patient Logan Way with more on this subject. Dr. Canfield, an expert in detoxification and addiction treatment, the founder of White Tree Medical, which is located in South Jordan. And Dr. Canfield, let me start with you. You say addiction is not a moral issue, it's a medical issue. Explain that for us.
Well, the cutting-edge research in addiction indicates that there are some physical changes in the brain that happen with addiction that are based on what the chemicals that people take in when they get addicted. Those chemicals cause a massive storm of dopamine stimulation, and that causes some new brain cell pathways to develop, new circuits in the brain. These are physical circuits. It's not just something where someone can choose not to have that circuit anymore. So it's a program needs to be able to help that circuit to be able to take as long as it takes to revert back to a healthy circuit.
So when you say medical issue, that distinguishes it from just something that possibly people could say, just stop. Why can't you stop? If you were a good person, you'd stop.
If you love me, you'd stop.
If you love me, you would stop. Why can't you try something else? And they physically cannot?
Well, they're trying, but they've got a neural pathway that prioritizes, I've got to get a big dopamine storm again. So when you have that physical pathway, you need some help that's comprehensive and long-term to be able to get you to where your brain is back to where normal brains are.
Logan, you're nodding while he's talking. Did you feel all of these things?
Yes.
And people said those things to you?
Oh yeah, there's been multiple times where, you're with your family and you feel it inside to where you want to do everything that you possibly can to stop, and then you find yourself the next day doing exactly what you were just saying that you weren't going to do. And it's tough. You feel it inside. You wish with every bone in your body, I don't want to do this anymore. And physically, you can't. You just physically can't do it. You need that medical help. You have to have it.
What was your breaking point?
I would have to say looking at myself and realizing that I was a different person. The bonds that you build with your family over time, seeing those break, those bridges, burn, it makes you look at yourself and realize, I physically can't do this, and I'm tired. I'm mentally, physically, and emotionally tired.
But it has to be all of those things.
It has to be all of them.
And it has to be about you.
Yes.
Dr. Canfield, what makes your program different?
Well, we kind of dispel with the patient, we dispel the rumor that it's a moral issue. We help them understand, we educate them about the changes in the brain. And what that does when they understand that is they finally understand, well, this is why I struggle so much, and this is why it takes so long to feel like I'm making progress. And it also helps them to understand it's not my moral fiber that makes this happen.
I'm not a bad person.
Right. And we tell, one of the things we tell people in the first visit, I take a lot of time, and I explain to them, this isn't a moral issue, this is a brain issue. And we're going to help you get your brain back.
I like that you said in the commercial break, when you're ready, we're ready.
That's right.
You have to be ready to want help, but then you're ready to give that. This is an outpatient program. We should let you know, everybody, you also work with insurance. WhiteTreeMedical.com is the website for more information. There's also a phone number on your screen that you can call 24 hours. We'll put that on our website at abc4.com/GTU. Logan, thank you for sharing your story.
Yeah, of course.
Dr. Canfield, thank you for being here.
Thank you for your time.
Reagan, what's coming up next?